Imagine trying to walk a straight line, but your muscles feel disconnected, making every step feel unsteady. And that's what Friedreich's ataxia is like, a disorder where the nerves struggle to communicate effectively with the muscles, leading to a loss of coordination. Named after the German physician Nikolaus Friedreich, who first described the condition over 150 years ago, Friedreich's ataxia is a genetic disorder that primarily affects the nervous system, but also has a profound impact on the heart and pancreas. So, what exactly happens in Friedreich's ataxia? It all starts on chromosome 9, where there's a gene called the Fxin gene. This gene is responsible for producing a crucial mitochondrial protein called frataxin. Frataxin plays a big role in creating iron-sulfur clusters, which are combinations of iron and sulfur that help certain enzymes in our mitochondria function correctly, especially for producing ATP, our cell's main energy currency. The tissues that need a lot of energy, like the nervous system, heart, and pancreas, contain high amounts of frataxin. Now, in individuals with Friedreich's ataxia, there's a genetic mutation involving an abnormal repetition of the GAA sequence within the Fn gene. Think of it like a stutter in the genetic code. Normally, this GAA sequence is repeated about 7 to 34 times, but in Friedreich's ataxia, this sequence can be repeated anywhere from 100 to 1700 times, with most people having repeats ranging from 600 to 1200. This excessive repetition leads to gene silencing, which means the Fxin gene doesn't get transcribed properly and the production of frataxin plummets. Friedreich's ataxia is inherited in an autosomal recessive manner, which means it takes 2 copies of the faulty Fxin gene to have the disorder. Usually, parents are carriers, meaning they each have one normal Fx gene and one expanded Fxn gene, but don't show symptoms themselves. However, when both parents pass down their expanded Fx gene to their child, that's when Friedreich's ataxia develops. When frataxin levels drop, mitochondria have a harder time making those iron-sulfur clusters, leading to less efficient ATP production, kind of like a factory running low on its energy supply. At the same time, iron starts to build up within the mitochondria, and it reacts with oxygen to create unstable oxygen radicals. These radicals cause oxidative damage to DNA and proteins in cells, leading to cellular dysfunction and eventual death. This damage particularly affects cells that heavily rely on mitochondria for energy, like neurons, cardiomyocytes, and pancreatic beta cells. Friedreich's ataxia usually starts in childhood, and one of the earliest signs is ataxia, uncoordinated muscle movement. This often begins in the legs, causing difficulty walking and frequent falls. Over time, the ataxia progresses to affect the torso, and many individuals eventually need a wheelchair to move around. There's also muscle weakness, loss of proprioception, the sense of where your body is in space, and a feeling of extreme fatigue. The condition doesn't just affect the nervous system, it also impacts the heart and pancreas. In the heart, the most common complication is hypertrophic cardiomyopathy, where the heart's ventricles thicken, making it harder for the heart to pump blood. This cardiomyopathy is often the leading cause of death in individuals with Friedreich's ataxia. In the pancreas, the loss of beta cells results in decreased insulin production, which can lead to diabetes mellitus. Diagnosis typically involves genetic testing, where we look for that expanded GAA repeat in both copies of the F gene. Other tests might include MRI scans to assess the brain and spinal cord, as well as echocardiography to check for heart wall thickness. Together, these tests help confirm the diagnosis and determine the severity of the disease. Unfortunately, there's currently no cure for Friedreich's ataxia, and treatments mainly focus on managing symptoms and improving quality of life. Physical therapy can help maintain muscle strength and coordination, while medications might be prescribed to manage heart complications or diabetes. The goal is to slow down the progression and keep individuals as comfortable and active as possible. Alright, as a quick recap, Friedreich's ataxia is a genetic disorder caused by a repeat expansion in the Fxn gene on chromosome 9. The excessive GAA repeats lead to reduced frataxin production, which in turn causes mitochondrial dysfunction and oxidative damage, especially affecting the nervous system, heart, and pancreas. Symptoms include ataxia, muscle weakness, hypertrophic cardiomyopathy, and diabetes. While there's no cure, supportive care can help manage the symptoms. If you found this breakdown of Friedreich's ataxia helpful, be sure to check out King of the Curve for more in-depth content on medical topics. Remember to like, subscribe, and hit that notification bell to stay updated. See you next time.